and welcome to this latest All in Skills podcast. All in Skills, for those of you who are new to this podcast, is a new platform. It's being launched in the coming weeks, designed to connect young people, undergraduates, new graduates, people new on the job market with experts in the field like today's guest, Mark Bekerman, who is going today to be talking to us about his career in the area of mental health. Mark, thank you very much for joining me.
Thanks, Colin. Lovely to be here.
And Mark, if you can start off by telling us who you are, where you are, and what it is that you do.
Okay, so you've introduced me. I'm Mark Bekerman. I am a 50-year-old who lives in Melbourne, Victoria, in the southeastern suburbs. And the career that I'm currently in is in mental health and regional planning and suicide prevention. It's quite a long title, and it's quite a unique position that I'm currently focused on.
Two of those things sound like they resonate, but did you say regional planning?
Yeah, regional mental health planning.
Okay, so how did you end up getting into this area? What's your background?
Okay, so I have multiple backgrounds. I couldn't make a decision when I was younger what I wanted to do. So sports science was one of the careers that I thought I'd go into. So I got an undergraduate sports science degree, and I went on to do an honours in psychology because I majored in sports psychology. I've also got a little bit of background in change management. In my first career choice was in youth work. So I've sort of done a lot of different little things along the way to trying to build a career. One of the interesting things about the Australian working environment that's different from other places is we have pseudo careers. Whereas let's say if you're in the UK and there's a job for someone who's a psychologist, they'll only advertise it for a psychologist and it must be filled by a psychologist. And then if you have jobs for social workers, it must be filled by social workers. Whereas in Australia, we sort of call those positions clinicians, and you might take a multidisciplinary approach to who can you get to fill the role and what skill sets are they bringing rather than a specific qualification. So over time, I've been with the luxury of having some sports science knowledge, some psychology knowledge, and community development knowledge. I've been able to fill multiple roles to start with as I've built experience and additional skills.
You've had tastes from many different dishes, if you like.
Yes. Yeah, and maybe all of those little areas that I've worked in. So again, Australia has a very unique way of dealing with youth offenders. So we have this thing called a dual track system where we keep youth offenders away from general population adult offenders. And on that system, only Australia, Canada, and Ireland have the same system. So I've worked in that youth offender system with both of those combinations of sports science with the psychosocial supports and then the psychology of working with people who have difficult behaviors and difficult histories. So that is one of the lenses that I take to the role that I have now in terms of regional planning. So it's looking at, I've worked as a boarding house master. So the opposite ends. In fact, I did those jobs at the same time. So working with some of the most privileged young people in the state, of the highest wealth and greatest socioeconomic power, and then going from there straight into working in a youth detention facility on the same day.
Maybe explain a little bit about how you got into that and what did that role involve?
Yeah. So but the role itself is for young. It was in Ballarat, which is a regional town centre in Victoria, and a lot of young people who live in rural areas. It would be impossible for them to commute to a rural town centre every day. So if they've got the means, they'll live as in that boarding house. And of course, there's other young people as well who might come from Melbourne who just want a good old fashioned education, or the parents travel a lot. So that's probably one of the reasons why, if it's not a common phenomena anymore, there's still a role for it to be played in Australia, which is such a huge geographical area. The role itself was every night there would be a rolling sort of crew who would be taking care of the young people. So in that boarding house, there are somewhere between 55 and 60 young people who are living there, ages from 11 to 17. And so you'd probably do a 2 or 3 shifts a week where you'd sleep over in the boarding house and been taking care of all the young people. You'd have dinner with them. So they would have general activities after school, and then you would be responsible for their well-being. And there'd be time frames about what age they are, what time they should be lights out. The role encompasses a little bit of parenting, a little bit of mentoring, a little bit of policing. In fact, quite a lot of policing. It also helps to have a great sense of humor about what you're likely to see when, for anyone who's got children of their own, one or two kids can be a handful. 55 of them can be loose cannons. So, and the reason I got that role is um, I was studying in Ballarat. I was doing my honours degree, and I needed somewhere to live, and they put you up in a house. So the nights that you're not actually responsible for the boarding house, and the you do one weekend, I think every third weekend. So the rest of the time they give you a place to live, and that appealed to me. Being a poor student, still at university, even though I was mature age, and as I mentioned before, I already have experience from working with young people, population of young people in a facility, albeit a detention facility. So I sort of had the skill sets that they were looking for.
Is it the case that you actually do have boarding schools which in the state system in Australia, or is it all entirely taken up by the private sector, private schools, independent schools?
Yeah. So in Australia, we have public sector, we have Catholic education, and then we have independent, which is everything that's not Catholic denominated. So it could be any other. As far as I'm aware, there's nothing in the state system that does boarding. Now that doesn't that could be for Victoria only. So I'm not sure what they do, in the Northern Territory. Each state, whilst the funding comes from the Commonwealth, each state delivers their own system. So in Victoria, the only boarding house schools that I know of are ones that are they're mostly regional, and they're usually Catholic or independent.
I think Prince Charles went to a boarding school in Victoria, didn't he?
I believe he did. Yes. In fact, I'm pretty sure I drove past it on a wine tour in March.
Now King Charles, but that back then before his promotion. Okay, so that's quite interesting. You contrasted that with your work with detainees. Was that prior to the boarding house, or?
Okay, so I started the role working in the juvenile justice facility, which works with 16 to 21-year-old offenders, prior to starting the role with the boarding house, but they did have a period of overlap. There would one day I'd be working until, for after hours, it'd be 6 till 10, running programs for the youth offenders. And there would be psychosocial programs. So it's using sport and recreation, again, that mixture of skill sets I had from a human movement sports science degree, mixed with the mental health and behavior management, behavior change programming that you get from that psychosocial background. And so I'd usually do that from around 6 till 10, three or four times a week. And then that would be one night. And then the next night I'd be in the boarding house with some of the students. So what I can tell you is the behaviors were not very different at all. And in fact, it was probably sometimes whether or not you had someone to bail you out, that meant the difference between which place Mark was talking to you on at 10 p.m. evening.
Interesting. Okay, so after this time, you finished your time in Ballarat, and then where did that take you? Which of these multiple roles did you assume next?
Yeah, so interestingly enough, youth work was where I found myself in my next role. I found a position. Most youth services that are delivered in Australia are delivered by local governments. They have a youth services team, and some of them will focus more on the advocacy and political aspirations of young people and giving them a voice in local government and beyond. Some of them will focus a little bit more on counselling and therapeutic interventions. And then others will focus a little bit more on that psychosocial aspect. And I just found the perfect role at the perfect time. After those other experiences, the role that I stepped into was in the Caulfield area of Melbourne. And that council, they had a role that needed both. They had some psychosocial programming that suited my skill set to a T. But they also they needed someone who could deliver individual counselling to young people who had some level of qualification. And this was quite some time ago. So the industry's changed substantially. We didn't used to have Medicare rebates for mental health plans in Australia. It was all either private or fully funded. And most people did a 4-year qualification, and then they did 2 years of practical supervision. And I was offered that pathway if I was to do the counselling and support, the psychological interventions in that role. So I took it. It was an opportunity to further both parts of my career, one which was very much based on psychology and delivery of mental health services, and the other part, which was that psychosocial intervention, which saw mostly, again, young people, because the youth service, in their formative years when most onset of illnesses, mental illnesses, actually take place anyway.
So, and how long did you stay in that role for?
I stayed in that role for 2 years before I got itchy feet, and I was recruited by an Irish prison for young people. As I said, that dual track system exists in 3 places in the world. That one of them's Canada, one of them's Ireland, and one of them's in Australia. And interestingly enough, at that time, which was more than 20 years ago, Ireland had an explosion of youth population. So in any population around the world, but we know that there's people of all ages. Most countries, people live to somewhere around 80 years old, and there's a pretty good balance between each 10-year gap. In Ireland, for whatever reason, they had a very, very young population, and it wasn't that they had a crime problem, it was this that they had a population problem. And so they were opening more facilities, but they didn't have enough people who were trained with those skill sets who could take leadership roles. And because I had substantial experience both in that system and then in a role that was taking place in the community, they recruited me to go to Ireland. And so I quit my role, said, "Oh, it's going to be a wonderful opportunity." My mother was born in England, so I had right of abode to live in England, so I could travel between. I would have a visa to Ireland at that stage, which you needed because you weren't necessarily going to get a role or the ability to live in both countries. But I could visit England as much as I want and see family. But I thought it would be a lovely opportunity to see the world and experience something different.
And
And
was
then,
it?
well, I quit my job, packed up my home, got ready to go. And I reckon less than a month before I was ready to move, it fell through. Even though I had a contract, it fell through. So I continued to work for a very short time in the role that I had resigned from. They were very happy to keep me. It's much easier than recruiting. So I continued to stay there until I'd saved up enough and I decided I would do an around the world trip. And I'll go for 12 months and I will just see the world.
And sorry, at this stage, were you still in your 20s?
I was 27. Yeah, mid to late 20s. And then off I went. And after traveling through the United States and then some of South America, I got waylaid in Brazil and got married. And then spent 5 years living in Brazil teaching English until we migrated here back to Australia.
Your time in Brazil, professionally speaking, was teaching English nothing to do with what you'd actually.
I did a little bit of work. It was very hard because initially when I arrived in Brazil, I had no intention of falling in love, getting married, and living in a country where I'd never heard the language Portuguese spoken before, and certainly not from Brazilians. If it had been, it had been Portuguese speaking, which is very different, as you might be aware. Um, it took me a while. So initially, I relied on that sports science background. So I did some private training roles with some people, and then I found some work teaching English. And then after that, I actually started to understand how the Brazilian system worked in terms of what they do in that social justice space. So none of it's funded by government like it is in Australia. It's all philanthropic. And so I found some philanthropic opportunities to help them and teach them systematized ways of doing that social justice and social equity programming, because they were doing it mostly out of love and out of goodwill, but not necessarily with any strategic understanding or educational backgrounds. That they don't have community services degrees in Brazil like they do here, because there's no industry for it. So I spent a little bit of time doing that as well, but it wasn't for a professional. I wasn't getting paid. If I was, it was just a pittance to help out. It was it was not going to sustain me a career path
Right.
over
Right.
there. Mostly it was English teaching.
But interesting to have that insight into completely different culture, different language, different environment.
But yeah, really so. It was one of the things that was a nugget of gold later in my career, when I got back to Australia. That one of my I had a couple of really good mentors that sometimes they didn't know they were mentors. They made such good decisions. So I had this one guy who, when he made a great decision, it was brilliant. And when he made a bad decision, it was absolutely horrific. It was like he was swinging from the trees, to get the big win. And one of the things he said to me is, I once came up to him and said, "Look, I want some additional funding to run this program." And he said, "I've got it, but I'm not going to give it to you." And I was horrified. I thought he was being really mean. He wanted me to fail. And he said, "I'll tell you why, because if I give you this and you get the resource, the staff that you supervise will get lazy, and they won't use their innovation to think about how they can do this more effectively. They'll just rely on the resource that I give you." And it was a great lesson, because he was 100% right. And that's the biggest thing I learned when I was working in Brazil, in that, with those philanthropic social justice programs, particularly ones where they would, like, there was one I recall that had an entire sort of compound. And it's hard, if you come from Australia, to understand. It's like a giant gated place, that community that has buildings everywhere, but they've got zero level of infrastructure and no funds to do anything. They don't have all the resources that we have. But the thing that was amazing is the ingenuity, the innovation, the ways that people would come up with ideas to teach activities. The thing that was missing for them is that strategic alignment between what they're trying to achieve as an outcome, and then the activity that they're doing, and ensuring that it stayed on track, and measuring the benefits that they're getting, so they know that they're doing really well. Now, that's something that may not necessarily be a need in a place like that, because then they might feel it and that's enough. But if they were going to look for funding, then that's something that they would need really to rely on, is evidence that they're doing well. And that's something that is really interesting, that stayed with me, because now the role I have is all about ensuring we've got evidence that things are effective.
Do you think that they had the means, the tools, the experience, the knowledge to do that sort of measurement, or it was simply something that passed them by completely?
Yeah, it's both. First of all, it wouldn't have even occurred to them. That's what you need to do. So that's that cultural divide, that people from South America, those Latin communities, it's more about feeling than thinking. It's more about connection and hearing. It's the qualitative, listening to someone and hearing what they're saying and their voice. And Western countries want quantitative data. Show me a report that stipulates what percentage change someone got comparatively to if they hadn't have done this program. And so it first of all, it was just not within their normal thinking. But secondly, even if it was, they wouldn't have had the resources, the tools, and the educational design elements to implement something that would have stood the rigor of, a bit of interrogation. So even if they wrote a report, it'd be picked apart quite quickly, because it missed some of the more rigorous components. And I think that it's the combination of those two things, where a little bit of Western ideology coming in and supporting helps for the funding part, but that connection that that people in Brazil have with each other and with other people, that's what drove its success.
So after Brazil,
Back to,
time
to
moved
Australia.
on to
So I moved
Australia.
on back to Australia, and sliding back into a role that I'd had, a very similar role to previously. So I worked for the department, department, the Victorian state government, working in youth justice again, but this time instead of working in one of the two detention facilities, I was supervising community-based orders. So young offenders who um, who I would supervise, and they had orders from the court to follow particular instructions about what they are required to do, so that after offending they can stay in the community and rehabilitate rather than be sent off to a detention facility, or as people know it, a prison. So yeah, that was a really interesting role too.
How do you measure outcomes in a role like that? Is it like recidivism or what's the
Yeah. So it's actually the simplest component of it is, are you able to tick the box that says that they followed the instructions that they were responsible for? So they have to attend all the meetings with you. Do they actually show up to those meetings? Are they required some orders, but they are only required to come and check in with you once every fortnight? Some more intense orders, they need to check in with you once a week. Some orders, they need to come and check in with you every couple of days. They'll be required in some cases to, if there's drug and alcohol involved, so substance use, they'll be required to attend counselling or harm minimisation programs for substance abuse. Most of them all have a must attend psychological therapeutic intervention counselling as part of it as well, depending on the age and depending on what is legally responsible. So they've changed the ages a couple of times since I've had these careers, but it used to be at that stage you had to attend school regardless until you were 16. You were legally required to be at school. So if the person was under 16 or 16 and under, did they attend school? So part of the metrics there for success is, are they just doing what's expected of a normal kid? And then there might be some other things as well.
sorry, just to understand
Yes.
these people, these young people, were they in families, in foster care? What was their what were their circumstances?
It ranged. There were some young people who were in out of home care, so they weren't with their parents anymore, not full time. Sometimes they would see their family. Sometimes they wouldn't have any connection with their family. Sometimes they were living with their family, but it was a split family. And sometimes they had a regular, everyday, both parents, brothers and sisters. They just had committed offences. The regional office that I worked in also covered the outer eastern area of Melbourne, where there is a higher Aboriginal population than other areas in Victoria, and so I used to work with that cohort as well. And so there's a completely different way of working with the native Australian community and what the needs are there, and family systems there look completely different because it's a collective culture. So the person I might be speaking to might be known as auntie, but might not be related legally, custodian, in any custodian way, to the young person. So yeah, it ranged completely. I stayed there for a couple of years. I had some pretty good wins in terms of successes, getting some young people through who, I mean, I think there's a realism when you work in that there's a percentage of young people you'll be able to help, and they may be small. And then there's a percentage that will skate through and do the right thing. We don't know where they'll end up, but they'll just skate through and do the bare minimum, but they get through and they're not problematic. There's others who are highly problematic, and there's others who you just know, doesn't matter what you try and what approach you take and how genuine and sincere you are in the care for them, that they're going to end up in an adult system anyway. So there's always those percentages. And I had some pretty good successes there, and I would have liked to stayed on, but it's always contract work when you work for the state government in those settings, and I was not going to be able to buy a home. No one would give someone who's on contracts, short-term contracts, even if they kept getting renewed 1,000 times over. There's no guarantee, so you couldn't get a home loan. So I had to find another role.
How much do you think there's an element of idealism when you take on a role like that, working with young offenders, for example, and how much is it? This is something handy. I'm doing this because I could be doing something else instead.
Oh no, there's none of that. Okay, so let me take you through a typical first 30 minutes or first hour of a day doing that job. So you've got a list, and the list of people who you are supporting and who you are responsible for um, is quite large. In terms of case management, which is what it is as a career, it might be two, nearly three times the number of people that you would case manage if you were doing that in a mental health setting. And none of them particularly want to have anything to do with you. None of their family want to have anything to do with you. If they're not with their family and you're calling for them at a facility, so they're an out of home care or some other arrangement that they've got, then you're annoying the people who you're calling and who pick up the phone, because then you have to take them out of whatever they're doing. So your first 30 minutes is calling all the people who you are supposed to have check in with you, because this is where I should be. I'm doing the right thing. And for the first 30 minutes, the amount of abuse you cop and the colorful language that comes out. So in that particular role, we worked in teams of four. So you had particular types of clients that you were working with, and you had your desks were arranged that you had three other colleagues that were doing similar role. And generally, most days after everyone had made their calls in the morning to see, make sure who's coming in, make sure who's at home where they should be, make sure someone's going to school where they should be, or they've got a court date that they need to attend, making sure they turn up to court so they don't get thrown in prison. And swap who had the most colourful language thrown at them in the first 30 minutes of attending work. There isn't anything after doing that job you could say that would ever offend me. It was virtually impossible to call me any name that would even get an eyebrow raised, because I think I heard everything over 2 years that could be thrown at me. So you don't do that job because, oh, it's a nice job, I'll just do that in between. You do it because you have a firm belief that you can help people and that you're contributing something back into the society you're working with.
So from that role, then, what was the next step on your career path?
Yeah. So then I found a role back into local government, into youth services, and that role was in a leadership role. So whilst it wasn't responsible for the entire team, I was responsible for a facility, so a youth centre, the staff that were in it, the running of the centre, and all of the intake and assessing for young people who required counselling services. So again, pretty similar in the alley that I had, but I also knew from at that point, I'm now in my early 30s, and I've got some experience that I can share, and I can mentor and support staff who were where I was 10 years beforehand into that field. So taking on that leadership role. So the mental health component is the service is doing the intake and assessing for mental health, for counseling, psychological intervention. So we at that particular role, there was a psychologist who was employed, and that psychologist was doing that 4+2 program I had mentioned earlier, where they were a probationary psychologist, so they need to develop a number of hours where they're supervised, and so they're more affordable. So they were delivering the psychological interventions, but in terms of assessing who was appropriate and the intake of those and the assessments of those, that was what I and my team were doing. And then the role, so that with local, again, just about all youth services sit with local governments. And local government, we know, it's a form of government. So it's cyclical, like any other form of government. And there's changes over time. So I just happened to be in that couple of year period that I was there. There was a change in how they were operating and the model that they were thinking about, and there was a changeover in staff. And I took on for a period of time a bigger role where I was responsible for what I was already doing, but I was also then responsible for some community development and community building activities as well. So that was probably my first foray into really community development programming, whereas everything before was more on that therapeutic, individual, psychosocial, or individual counselling, like I had done in my first stint when I was in the Caulfield area.
And so then after that, did you stay local government? Did you do something quite different?
I did. It was really interesting. So I went to a state forum for a funded, commissioned program that had been going for nearly a couple of decades. And every local government was funded to be able to deliver this. And it was the first time it was actually going to be closed down after nearly 2 decades of, again, every 2 to 3 years, there's a new government that comes in, whether it's state or federal, funding starts to look different. There's always thoughts that it's not going to be refunded, and everyone gets nervous. What are they going to do? Who's going to have a job? And it always works out. And I went to this state forum, and I didn't know anyone. So I happened to sit down next to someone, and they were the director of the next council along, and they had been having trouble finding someone to run a particular program in their youth team. And we got talking, and she said, "Are you interested in moving at all?" I said, "Well, it depends what the role is." And she told me what the role is, and it was to be the program manager. Or see, the thing is that it doesn't matter what sector you're in, the titles always change. Effectively, it was a program manager of a mental health program specifically for young people, but it was a team leader role because at council, that's the banding that they have. And she told me about it, and I said, "That sounds interesting. I would be interested in applying." And I thought I would never hear from her again. And then the person responsible for the youth department called me up literally 2 days later, and it was a very unusual conversation. "Hey, my boss said they bumped into you, and we're looking for someone. Do you want to come and interview?" Sure. And so I wasn't necessarily, again, looking, but my nature of being happy to have a conversation with people to learn. I'm always, even now, I'm so curious about everything all of the time. So my curiosity of asking what's happening for somebody else, using the 2 ears and only the one mouth, 50% of the time talking, but more time listening, meant that I found myself in another opportunity again. So I took on this role with this service that was performing really poorly, and it wasn't very well systematized. It didn't understand what its intent was. They just knew that it was delivering sort of therapeutic interventions for young people. And I reworked the entire program so that it started to use what was current best practice. And at that time, there was this idea in counseling called single session therapy. And an explanation of that is really simple. The average number of sessions you get when you go with your Medicare card and you go to see a psychologist that the doctor gives you a referral for is 6 sessions. And the reason for that is the most common therapeutic intervention, CBT, cognitive behavioral therapy, roughly takes about 6 sessions to get through. And most people have some level of anxiety and depression. That's the most common combination or individual issues that people go and see support for. And CBT is the primary mode of therapeutic intervention for that. And the way that works is it's sort of it's cumulative learning effectively, which Australia loves to do. America loves the gap fill approach to education, which is I'll tell you a piece of information over here, and then I won't tell you what happens next. I'll tell you what happens way over here. And you'll go, "So what happened in the middle?" And that'll pique your curiosity. You go, "That's the gap that we'll fill with the information." So it's piquing curiosity. We have a different way of approaching things. All our education system is based on cumulative knowledge. I'll tell you a bit here, then I'll tell you a little bit more here, and then I'll tell you a little bit more here. And then gradually over time, you'll accumulate the knowledge you require. And that's what counselling, particularly those CBT 6 sessions, are like. Problem is that until you get to the end, maybe you're not developing what you need and you might not come back. And there was lots of evidence to say that most people only go to counseling 1.4 times. Like they don't even make 2 sessions. The average number of counseling sessions attended across the board was 1.4 at that time, which was again a couple of decades ago. And so this idea of a single session therapy, which is you get something uniquely important to you out of every single session. You take something valuable away each time. Now, maybe it'll work cumulatively, maybe it won't. But what we know is you need something right now because the chances are if you don't get it, you're not going to come back again because you're only going to get 1.4. So we created a model based on that newer way of approaching things, and suddenly we're able to see exponentially like 200% more people in the first. It also was really effective, and it got quite popular in terms of the demand increased substantially. So we started to increase what it could do and filled gaps in the area. So it was quite a great system, but also um, it I also used a file management, and the reason it was unusual is it used what today everybody uses, which is the internet, to record your information. So it was the first time that any council had used a data management system that was cloud technology. And I remember trying to convince a local government group of directors that this was a good idea, which, again, nobody knew anything about it. And they're all nervous about, you don't own the data. I have to convince them that we need this system because we worked in multiple settings. We had 3 different youth centres. We had, 30 different schools. We did outreach. Yes, you could go and get in a car and drive and see people, but you needed to record all of your case notes right there and then, and you needed access to your information right there and then to see histories and other things. So it needed cloud technology, and no one understood it. So what I did is those giant checks you get, the fake checks if you win a tournament. So I made one of those giant checks, and I made it out to, like, for $1 million to one of the directors. And I walked in, and they were expecting some PowerPoint presentation, some fancy thing. And I just handed one of the directors this giant check and said, "You just won the lottery." Again, 20 years ago, $1 million bought you substantially more than it buys you now. You could buy you a couple of houses then. Now it'll get you a big mortgage. In fact, it probably won't even get you a beach box. What do they call it? A little beach box down in Sorrento. I think one went for more than $1 million recently. So I handed her the check and said, "You've just won $1 million. What are you going to do with it?" And she said, "Oh," she started telling me about what she was going to spend. I said, "No, no, where are you going to put the check? This is a real check. You've got money. Where are you going to put it? Are you going to go home and cut a hole in your floor, put a vault in there, put security cameras everywhere? Are you going to hire security at your front door with guns? How are you going to protect your money?" She said, "I'm going to put it in a bank." "In a bank? What do you mean you're going to give it to someone else, but then you won't own it? They're going to have it. They're going to have control of it, but it's still mine." "Yeah, but it's all it is just digits now on a auto teller. You're not going to have it in your hands." And she said, "Yeah, but we know that it's ours." And I said, "Guess what? You're talking about cloud technology." And so I equated all of the fears that they have is, you own the data. Provided you're smart enough to find a system that allows you to extract what you need, if you ever need to lose that contract and migrate your data, you just have to have a system that gives you the right technology to migrate it. And so I convinced them very clearly that having our internal IT team try and create a secure environment with the really poor tools that they had, and then try and help us get that system, filing system, elsewhere, would be absolutely useless for the amount of money that I could spend to develop one on using cloud tech. And they bought it. And what we did is we designed a system with a provider that allowed me to do everything in an automated way. So everything was radio buttons. It wasn't free text. Forced choices, and then all the data was captured, and I set up reports that I'd press a button for the time frame, this month, last year, and it would tell me every single piece of data about how the staff operated, what they were doing well, what they needed to improve on, how many minutes were spent between appointments, how many minutes were in appointments. And part of it was a change management part where I needed the staff to understand it's not there to catch them out. They do great work. But unless I've got data to demonstrate how effective they are, I can't tell the story to anyone. And once they understood that it was used to demonstrate how great it was, and I had the trust of the team. If you do something well, but you don't document it and document it in a way that people can interrogate it and it holds up to the interrogation, it's worthless because there's only so many resources and we're all fighting for resources to do the work we need to do. And so that was probably a really great lesson that I learned doing that. And And it was in that role where I first got into suicide prevention.
I'm glad that you raised the suicide prevention because this is a role that you currently
Yes,
fill. So perhaps you can tell us how you made that transition from presenting massive checks to people to convince them to use cloud technology and into suicide prevention.
sure. So the area I worked in the outer southeast of Melbourne, now, even today, which is 15 years later, had the highest number of youth suicides, where there was what we call a contagion effect. So we call that a cluster. So that's where there's a connection between the young people. It's not necessarily causal. So we're not talking about where young people agree to take their lives at the same time, but where young people at different times are known to each other, and for whatever reasons, and they might vary, they're connected, but those deaths are connected to each other for one reason or another. And so in that region, it was because I had that great data system that my staff and I started to hear in some of the counselling sessions and some of the calls from schools that there seemed to be some distress amongst young people for suicide. And not their own suicidal ideation, because we were quite used to that. That comes with the territory when you work with young people. But what we were hearing is that there were already deaths by suicide, and the stories we were hearing were, they sounded really similar, but then slightly different. And so what we wanted to do is clarify: is this one person who took their life, but it's that Chinese whisper. Once it's passed on, it's a little bit of a different story. It's got a different flavor to it. Or is this a number of different young people who are very strongly connected because there's such similarity between them? It's more than one young person who took their life. And so we called together all parts of the community. By then, we had really robust relationships with clinical mental health at the hospital, with headspaces were just starting to come on board then. Not aware there that there's the national youth mental health programming. We had great relationships with schools and the regional school leaders, and then some community members. Staff who work at local government also live in the community as well, and they hear a lot. It was also around 2000, between 2010 and 2012, is when the internet for young people and social media started to take off. So we were seeing a lot of rhetoric on social media about this, and we called all these people together and said, who knows about any of these situations? Bring that knowledge together, and we started to talk, and we actually realized that there was an issue, that there'd been a number of young people who sounded very, very similar. So they must have had lots of connections or much similarities in their lives, who had taken their life, and not one person in that room knew of the other people other than who they were supporting. And so um, it's interesting because councils have this role called emergency management response. Every council is required to, if there's a major emergency in their region, put together strategies and plans how to deal with that emergency. And of course, they're usually about flooding, about a major fire, a bomb. It's about evacuating people and giving them somewhere stable to stay. The normal everyday stuff we would think about emergency management. And both myself and the manager of the department that I worked in, which was a step above my current boss at the time, we were both on this emergency management group. I was responsible for like debriefing, taking care of young people who'd been evacuated, to a facility, and keeping them all calm, and registering those who had, were really traumatized by it. And my boss had, or the manager of the department, had a responsibility for general oversight. And we looked at each other and said, we need to do something about this. No one here has a responsibility. We looked into if there's any type of responsibility for mental health responses, suicide responses, for emergency management sort of scenarios, and we there were none. And so we said, we need to do something about this, and we agreed no one else would, we would. And what we did was we called together the very first multiple agency from multiple sector group that agreed to work together after the death of a young person by suicide to protect others in the community, because the risk, particularly for young people, if someone close to you has suicided, your risk for suicide yourself increases dramatically, particularly in young people. That contagion effect doesn't happen very often for older adults. It's very strongly linked to young people.
Sorry, what age cohort are we talking about here?
Okay, we technically call young people under 25, but what we found, and what we do find, is that contagion effect happens substantially more for 21 and under. So we wouldn't exclude anyone 21 to 25 from what we'd call a response, from doing something, if we hear that there has been a death by suicide. And it's also, we've got to also look at that different from what we call bereavement services. So after a death by suicide, there are systems already in place, and have been for more than 25 years in Melbourne, that people who are bereaved, like family and really close friends or witnesses, they get immediate counselling and support that's offered to them. And most of the time, they're interested in taking it up, at least understanding it. They very rarely decline it completely, but they're made aware of it and really connected to it. Not much was done for an entire community. Or let's say a school community, a young person at a school dies by suicide. So what happens to all the students there? What happens to all the friends? What about all the people that played sport or did scouts or something else with that young person? These sort of community-based responses for those who are secondarily affected and impacted, but aren't, grieving the way a really close family member would, they didn't exist. And we created this thing, and it's called postvention responses. So postvention meaning we know the term prevention. Postvention is what we do to support people after a death by suicide. And what we know is, because of the risk to people themselves after they lose someone close to them or they're impacted by the death suicide, you're actually doing a lot of prevention work as well. So we developed the first group that was working across every sector: school, AOD services, mental health, other psychosocial programming, councils as well, to try and ensure that there was a full picture of what the community were experiencing, and that there was also a full and complementary service support from all of those sectors, prioritizing the needs of those who had been impacted from a death suicide.
So, in the event that unfortunately a young person does take their own life,
Yes.
is there like a whole sort of plan of action
Yes. So
available?
we created a plan of action. Unfortunately, after a couple of years of doing these plans of action, we ran out of time and energy, and we had also made a really strong impact. So there was a much reduced risk to young people in the region that we were working in. So we sort of stopped doing it, and we didn't know that we were on the right track. It was only after. So one of the things that's really i- is an interesting thing. When someone dies by suicide, the coroner's court has to make a determination of cause of death. And it can take them quite a lot of time to determine what that cause of death is. So a single suicide can take 12 months or longer. They interview family, the police do a lot of work in the background to understand motivation, what were the other factors. But if you're talking about where we think there's contagion and cluster, then you've got to incorporate what's happened for other people that is either more current or in the past. And so it can take 18 months or more to get that sort of determination back. So we supported the coroner's court by putting together a lot of reports about the work that we were doing, and we did a lot of interviews with them about what we were seeing. And it wasn't until after we had stopped doing it that the coroner's report came back out about the type of work we were doing and whether it was good, bad, or indifferent. And that coroner's findings was that what we were doing was sort of groundbreaking. It was really, really important. And there were certain things that they would like to see systematized in it. So it was working across other places. So then another region that was close to us, in fact, back to where I'd just come from previously, my previous role, they were experiencing suicides as well. And so we went, and I wouldn't call us experts, just look, we've just experienced it. We'll share our knowledge with you. And they wrote up what is called a protocol document based on what our work was. And those protocol documents now are pretty much standard, and we call them in Victoria a postvention protocol group. But the key things in there is that they're going towards a protocol. So, as you said, it's a systematized way with a plan of action, with agreed framework that everybody works from. So, I was responsible for sort of creating that environment, and then a couple of years later, still in the same role, the government started to fund these things. And so someone was funded in our region from a different part of the sector. So in what we call the primary care setting. So across Australia, we have these Commonwealth funded services called primary health networks. And those primary health networks, what they do is they work with GPs and other primary care professionals to work on some of the really big ticket items that are health issues. So diabetes and other things. And the primary health networks as well, they work on filling gaps between what the Commonwealth Fund and what the state do, and working with priority populations and those who are most in need to ensure there's equity in the system. And so the primary health network were fairly new in just being established at that time. And they were being trialled for these postvention groups. And the person who was working in the area sought me out because I'd done it previously. And then I worked together with her for about somewhere around 4 to 5 years to reinvigorate and bring to maturity a really strong ongoing group that would continue this work in the outer southeast of Melbourne. And then it went from being funded into trials to being fully funded by each PHN across the country. So we have 6 primary health networks in Victoria, and the Eastern Melbourne Primary Health Network is where they had these new roles for suicide prevention coordinators. Uh, the both of us looked at these roles, and someone who knew that we were doing that work said, "We've got the perfect role for you." Again, it's that situation where you're open, not necessarily looking, but you're open to asking questions and what would that look like and how would you like me to do it and what's it going to be. And so about 2.5 years ago, I moved to the PHN in the eastern region of Melbourne. We're responsible for 12 regional mental health planning and suicide prevention for about a quarter of Victoria's population, about 1.65 million people, and 12 municipalities. And that's the role I've been doing for 2.5 years. I We receive really large chunks of funding from the Commonwealth Government. And then with those, we have to see what the gaps are, see where they need support, and fill those gaps with services, and then commission services, design what the service should look like or the activity should look like, and then commission those out to agencies that everybody knows the brand names of, like Headspaces and other things, and the services, the community services that you know that are in your area. But largely, nobody ever knows who we are because we don't deliver services directly. There's a lot of really interesting competing needs behind it. It can be really challenging. It's very fast paced. It requires a lot of agility, and it's always changing because it's always based on government funding and policy. So we just had an election recently, and a federal election, and then whatever the budgets permit and whatever the funding will be will change what we can do. Hopefully not in a drastic way, and hopefully in a positive way, but there's always those changes and you have to be prepared for them. And so you have to think about sustainability. So one of the things that I like to think about in terms of where I've been and what I've been doing was when I worked in that Caulfield area, sort of like middle east, southeastern suburbs, I was really working a lot of one-to-one. Then I moved to sort of the Mornington, not necessarily all the way down the peninsula, but towards the Bay area of Melbourne, further out in an area that had a really low socioeconomic environment and really lots of kids doing it tough. And then I was sort of building teams. And then the next role, I wasn't just building teams, I was building services. And then within the same organization, we were starting to look out for an entire municipality worth of need, and maybe even 2 or 3 municipalities and large ones as well, large geographies, really, really large populations. So starting to look at how do you build system within other organizations and collaborations. And then now I've moved to working for an entire sort of region, a quarter of Victoria's population, and looking at how do you systematize things? How do you have service design, system design, and how do you have different systems really have mechanisms that integrate better and work across them? So I'm sure that the next iteration of what I do will be, what's the next challenge? How can I contribute to a better world and helping those who? It's really interesting because one of the things you asked me is that first job working for, youth justice. Is it something you just do gap filling, or do you have a real passion for it? There's this idea of hope that in every service or every role that I've ever had, I've thought about, and that is the idea that no matter what's happening for someone, there's hope that things will get better and improve. And so whether it's doing it individually and that individual will be able to get better, whether it's a family, whether it's a system. So now I'm in, the role of hope that the whole service system will be effective in serving people. And I think overall, that I've kept the inquisition, like I love learning. I might be doing something that's not suicide prevention and mental health, next year. It may be that I'm working a little bit more in data. There's a potential that I'll be doing more algorithmic data surveillance and data engineering. Who knows? But I think the important part is that you're always open to learning new skill sets and the opportunities that are there, having that inquiring mind, no matter, so some people, they go, all right, I'm going to train, I'm going to be an accountant and I'm getting numbers every day for the rest of my life and sit in front of a computer. And that's what makes sense to me. And so it's important, I think, that your job makes sense to you. I get up every day and a lot of people go, how do you do it? Like being surrounded by all the things that you have to think about. It makes sense to me to do it. So as long as you continue that sense of inquiry, I think that's really important for a career.
Mark, you've been extremely generous with your time, and I really appreciate all you've told. And thank you very much.
It was a pleasure, Colin.